Thank you. Thank you. Thank you, Joe. I want to thank you and Sarah and your family for always inviting me back, and thank you to Jim and Kelly Bialik for leading the patient safety movement. I want to acknowledge the presence of my good friend and one of, I think, America's most important public servants, Senator Amy Klobuchar from Minnesota. I thank her for being here. This is the third time I have been to the Patient Safety Summit. Since I am neither a doctor or another medical professional, I feel like somebody's sixth or seventh husband. I know what I'm supposed to say, but I don't know if I can make it interesting now. But yeah, you think of it, especially when you're 68. But I love this movement, and I want to tell you why and encourage you to do more. We all know that no one knows exactly how many lives are lost, but the range is now apparently somewhere between 200,000 and 400,000 a year, or 440,000 a year, according to recent testimony at a Senate subcommittee, of people who die unnecessarily from preventable complications like sepsis and adverse drug reaction, which I am trying to do something about by making Naloxone more affordable and more widely distributed and more user-friendly in its access through our Health Access Initiative. Through falls, something that you got to think about as you get a little older and your balance is not quite what it once was. It's ridiculous how many times I try to just stand on one foot during the day so I'll have a little balance in case I need it. And through erroneous diagnoses. But you're doing something about this. When Joe said that, he told me, he said, I want to have a movement that will get us down to 0 preventable deaths by 2020. I thought, well, I've always been one for big ideas, but this is like when John Kennedy said we were going to the moon, except all he had to do was make sure he had the people in place to master a technology and people crazy enough to go up in those spaceships. This is like turning around the Titanic. This is like what I try to do with our Alliance for a Healthier Generation in reversing the tide of childhood obesity. It was going to be really hard. But the first year there were 60, and the second year there were 600, and now there are more than 6,000 lives you can point to as having been saved. Now, I don't know anybody who improves performance year on year at 10 times better than you did before. But if my numbers are right, and you do 60,000 this year, then you will meet your goal 4 years ahead of schedule. And you should, and I guess what I want to say is, you can discount my expertise, but I do know something about what works organizationally and in terms of human interactions to get positive results. I actually think it's achievable. And the reason is that you have built a unique network of creative cooperation. If you just read the news every day, you would think every healthcare policy in America should include unlimited coverage with no copays and deductible for psychiatric care, because we'd all be depressed all the time. And look, terrible things are happening. It was terrible when ISIS murdered those boys for watching a soccer game, or when Boko Haram hooked up a bomb to a 10-year-old girl to go kill a lot of innocent people. There are terrible things happening. But one of the things you have to do, particularly if you want to influence the course of human events, is to ask yourself, where are the gaps between the headlines and the trend lines? And the trend lines are pretty good in this old world of ours. This year, the Millennium Development Goals, forged 10 years ago, will expire, and the United Nations and the leaders of the world will have to decide what the next set of goals are. But I certainly hope they will adopt some, and they should be ambitious. We will not meet all the Millennium Development Goals, but it is clear that two very important ones will be met. One, in reducing extreme poverty, and two, in improving health care. Infant mortality is way down, maternal mortality is way down. We are on the verge of developing delivery systems, and my foundation works on this, that will dramatically reduce the death of children under 5 from waterborne illnesses. And knock on wood, we're working in Nigeria today to try to distribute oral rehydration therapy and zinc, even in northern Nigeria where the Boko Haram is strongest, and they have not yet stopped us from working or endangered any of our people, something for which I am grateful. So it's important if somebody had told you 3 years ago, there's going to be this patient safety movement with this crazy idea that we can eliminate all preventable deaths by 2020. Well, how many are there? Oh, there's somewhere between 200,000 and 400,000 a year. And you're going to get rid of all of them by 2020. You would have rolled your eyes. If somebody had told you that 2 years after they started, they get to 6,000, you would have rolled your eyes. Amazing things are happening in America and all over the world where people of different perspectives, different skill sets, different knowledge areas get together and think about how to achieve a common goal. It works better than anything else. I'll just give you an interesting example. We're in the 10th year of the Clinton Global Initiative, which most people know is a program I host at the opening of the United Nations every year, where we have world leaders and business leaders and philanthropists and leaders of non-governmental organizations, including a lot from very poor places that we just fly in to participate. And when I started, it was the first meeting of its kind where we said, you can come to our meeting, but you have to promise to do something. There's no minimum amount of money, but you got to promise to do something to try to ease these problems you say you're concerned about. There's plenty of meetings you can go to in better circumstances than fighting New York City traffic during the UN. I used to say when I went as president to the UN in New York, I made the traffic so much worse, I was convinced it cost me 30,000 votes every time I went up there. So I said, here we are, we're going to ask people to come brave the traffic. They're not going to Davos, they won't be skiing, and we're telling them they got to pay a little admission fee, and oh, by the way, you got to do something else, and if you don't, you can't come back next year. I thought, this is a really dumb idea, but it's important. I'm going to try. So 10 years later, we've had several thousand commitments that in the aggregate over a 10-year period will be worth $90 billion that have already helped 430 million people in 180 countries. Why? Because people are dying to be asked to make a difference. And I'll never forget the most important thing that happened to me through middle school. This is really important in the context of the world we're living in today. I was in 8th grade science, and my teacher, Vernon Doki, was an ex-coach, but he was really smart. He had a beautiful wife named Verna Doki, who was my algebra teacher, and a beautiful sister-in-law named Mary Matasserman, who was my history teacher. Vernon Doki, to put it charitably, was not a particularly beautiful man. He had Coke bottle glasses, and he wore clothes that were too tight, and he smoked cheap cigars out with a plastic cigar holder that he put in his mouth like that. But he was really smart. So the last class of the year, the end of the year. He said, kids, 25 years from now, you're not going to remember a thing about 8th grade science. If you don't remember anything else, remember this. Every morning when I get up, I go into my bathroom and I throw water on my face to wake up, and I put the shaving cream on, and I shave, and I wipe the shaving cream off, and I look in that mirror and I say, Vernon, you're beautiful. And we all laughed, and he said, you can laugh, but you just remember this. Everybody wants to believe they're beautiful. And look, I'm not naive. I spent a lifetime in politics. I know that interests collide, that people have honest disagreements, that people have disagreements powered by their economic self-interest. But the ability of people to reach across those divisions, if they feel that it matters and that they are valued, is staggering. That's essentially what you're doing with this patient movement. You got all the patient advocates, and then you have healthcare providers that the patient advocates have spent, many of them, many years being mad at, often for very good and specific reasons, deciding that if we don't do this together, this is not going to get done. Now, America has 10 problems like that, or 100 or 1,000. It's what works. And this is what I was going to tell you. So at the end of our 10th Clinton Global Initiative, here's what we found. We found that 40% of the commitments made over a decade have been completed. 40% were still in progress, but certain to be completed. 14% were in various stages of progress, had some problems, but they were really trying, and there was a reasonable chance they could be completed. And 6%, just failed. They just couldn't do it. And in a way, we learned as much from the 6% who tried and failed as we did from the others. But here's the most important thing. The commitments that involve genuine partnerships of diverse groups and individuals were substantially more likely to succeed than those of one organization or one individual tackling the problem on their own. And in fact, those commitments, the partnership commitments, exceeded their goals. So when we started, 65% of the commitments were partnerships. Last year, more than 90% were. And we spend all year long now trying to help people make these commitments and keep them. And we always try to get them to get partners. President Obama said a few years ago that the country needed 100,000 more STEM teachers. Well, I knew there was no way he was going to get enough money for 100,000 STEM teachers out of the Congress and under the current financial circumstances. So we started with 12 and all of a sudden had nearly 30 partners who put up enough money that more than 30,000 of those teachers were provided on a continuing basis with no involvement from the national government, just because they decided to do it. What's the point? None of those people individually and none of them collectively had remotely as much money as the federal government devotes to education. But if they focused like a laser on something that was important, they could make a difference. It's really important that all of us recognize every single day when we get up, just because we can't do everything doesn't mean we shouldn't do anything. Because look where you are now as compared to where you were just a few years ago. So I want to continue to support you and encourage you. And like I said, you'd all be billionaires if you had produced a tenfold return 2 years in a row with a startup in Silicon Valley. But the lives you're saving are worth more than all that money. They're worth more than all that money. And also, changing the culture of healthcare so that patient advocates are welcome partners and people who come into the healthcare system feel empowered to ask questions, stick up for themselves, ask for other opponents. That's important too. The great thing that is working, I see all over the world, is when you take experts in whatever subject area and put them in touch with experts in the real life and the real place where people are living. And so I just want to say that just think what this would mean. It also happens to be very good economics. I mean, when we started working in earnest a second time in the last 25 years on healthcare reform in 2010 when that bill passed, our country was spending 17.8% of GDP on healthcare. No other big rich country in the world, big rich country, was spending more than 11.8. That's $1 trillion a year. McKinsey and Company spent 3 years issuing 3 reports trying to analyze where the differences were. And they did that. The only thing they didn't do is properly account, I think, for the extra paperwork costs on employers for compliance, which adds a huge amount of money. Last year, we had added millions of people to the ranks of the insured through the Medicaid expansion and the healthcare exchanges. And we were spending 17.2% of GDP on healthcare. And will it go up as we age? Probably. But the goal should be for ourselves economically to move toward closer convergence with Germany and France, which are generally in these international surveys score the highest, or the countries that are rich and nearest us in the amount of money they spend, Switzerland and the Netherlands, for different reasons. Switzerland is a wonderful place, but the delivery costs are fairly high. You've got a lot of people living in small villages and way up in the air. And in the Netherlands, there is no direct government funding of health care, but there is a universal individual mandate. And the government just subsidizes people on a sliding scale based on what their income is. So they were spending, when we were at 17.8, Switzerland and the Netherlands were at about 12%. But France is the only country with an economy big enough to be rationally compared with ours, and they were at 11.8. Germany was at 11.5. Canada was over 11. Everybody else, Japan was low at about 9.5. The UK is up to about 10 now. So we know what it costs to run a good healthcare system. Now, thanks to you, we know what can be saved if you manage it right and you get better health outcomes and more bearable costs, which will clearly benefit the economy over the long run. So I just want to encourage you. I know Joe's going to come up here and ask me some questions, and we'll talk a little more about some of the details, but the main thing is the big picture. My native state of Arkansas, for most of my life, ranked 49th in everything. Our state slogan was, "Thank God for Mississippi." But we just, the service of our governor for the last 8 years just ended, and he was a very, very close friend of mine, so I'll plead guilty to that. But in this highly contentious political environment, the states in America that had the largest drop in the percentage of uninsured people were Arkansas and Kentucky. And in Arkansas, to take the Medicaid expansion, because everything requires 3/4 vote of the legislature to appropriate money, even if it's federal money. And our legislature is Republican, so our governor had to get all the Democrats and more than half the Republicans. And he just made a simple economic argument. And we also started going more to all-payer systems where we're paying for performance, not procedures. And in mid-October, Blue Cross, our major insurer, along with its partners in Arkansas and neighboring Louisiana and Texas, where they think this is rampant socialism and should never be entertained, announced what they intended to do with insurance rates. They announced they were going to ask for a 14% increase in Texas, an 18% increase in Louisiana, and a 2% decrease in Arkansas. And because there was no cost shifting, no rural hospitals closed, no disasters occurred, nothing bad happened. It was all good because people were working together based on the facts. And because the Republicans didn't want to vote to take Medicaid, the federal government gave them permission to convert it into a private insurance plan, and Blue Cross agreed to issue it at cost. So they wouldn't make any money out of it, they just recovered their administrative costs, which is essentially how the Dutch system works. It's all private insurance. And I think it's an example of the kinds of things we ought to be doing. But I am telling you, you will move the earth if you keep these numbers going. If you can do this ahead of schedule by keeping these exponent, and you can make the number if you get more partners. It's just a question of how many people are within the embrace of this movement. Then I'll get you interested in the community health work we're doing here in the Coachella Valley and other states around the country to reduce problems in the first place. The efforts we're making among our young people to reverse type 2 diabetes before it eats them and the rest of us alive. But giving people their life back is the most important thing. You should be very proud, and you should trumpet it. Go out and tell everybody. Go up to total strangers and tell them. Do whatever you have to do to get enough partners to make the number 0. Thank you very much.